Hello, this is Laura from section 32, and I'm gonna be reading the exercises from the book Professional English in Use from chapter 24 to 34. Match the two parts of the sentences, look at A, B, and C opposite to help you. 1988 saw the UK launch of Live Attenuated, that is measles, mumps, and rubella MMR vaccine. Chickenpox, varicella is a common infectious C. Become carriers of the virus. Rabies has an incubation period ranging from 4 days to many months. The patient remains febrile. Um, with peaks of temperature of 39.5 Celsius. Um, he was admitted with a 4-day history of influenza type symptoms of fever with rigorous myalgia and general malaise. Quite a proportion of patients who recover from hepatitis B um, become carriers of the virus. Um, The central part of Africa is in the midst of an epidemic, that is, pyrexia of unknown origin. Measles rubella is most infectious during the catarrhal stage. Lyme disease is caused by transmission of P. bordeauxferi from animal to man by exotic ticks. PUO stands for pyrexia of unknown origin. Complete the case report on the patient in A opposite. Look at A, B, and C opposite to help you. On examination, he looked unwell. His pulse rate was 100 per minute. He had a palpable spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasite in his blood film. Complete the sentences, look at B and C opposite to happy. An infection which can be treated successfully with antibiotics is curable. Another word for an epidemic is an outbreak. Um, Bacteria and viruses are example of microorganisms. Someone whose temperature is normally febrile or paroxysmal. The common infection with Epstein-Barr virus is known as glandular fever. Complete the table. We worked for A, C, D, and E opposite to help you. Affective, anxiety, anxious, behavioral, dementia, demented, disturbance, disturbed, suicidal. Make word combinations using a word from each box. Two words can be used twice. Look at B, C, and E opposite to help you. Behavioral syndrome, eating disorder, major depression, mental retardation, personality disorder, psychomotor retardation, sleep disturbance, substance abuse. Complete the sentences. Look at A, C, D, and E opposite to help you. The way a person behaves is his or her behavior. A persistent emotional state is a mood. A sudden attack of anxiety is a panic attack. The form of dementia associated with aging is called senile dementia. A disorder which is not associated with pathological changes is functional. An idea which forces a patient to repeat unnecessary actions is a compulsion. Which symptoms of depression was this patient suffering from? Look at C opposite to help you. A 56-year-old woman presented to her general practitioner complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight was steady. Tiredness, loss of interest, sleeping poorly, insomnia. Complete the table. We worked for A, B, and C opposite to help you. Blindness, consciousness, deafness, dizzy, dizziness, numbness, lightheadedness, unsteadiness. Make words combination is a word for each bugs. Double vision, epileptic fit, prodromal symptom, urinary incontinence, visual acuity, syncopatic. A doctor is trying to determine the cause of loss of consciousness in a 52-year-old man. Complete the doctor's questions. Look at C opposite and at the table in 26.1. Sorry, point one about to help you. Did you lose consciousness suddenly or gradually? Did you get warning of the attack? What were you doing before you passed out? Were you worried or under any stress at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice any involuntary movements while you were unconscious? Complete the table with words for name and be the opposite. Absence, absent. Diminution, diminished. Flaccidity, flaccid. Spasticity, spasticity, spastic. Wasting, wasted. A doctor is giving instructions to a patient during examination of the motor system. Identify what the doctor is assessing in each case. Look at A opposite to help you. I like you to relax. I'm going to move your arm and up and down. Muscle tone. Can I see your hands, muscle back, and possibly involuntary movements? Now I'm going to straighten your arm and try to stop me power. Can you touch my finger with yours and then touch your nose? Good. Now do it again with your eyes closed. Coordination. Completed the sentences. Look at A, B, and C opposite at the table in 27.1 above to help you. A flaccid hand drops limply to form a right angle with the raised breaks. Reflexes are reflexes that are stronger than normal. Wasting means the muscle is reduced in bulk. A tick is a form of involuntary movement. A key is often used to test the babblings and plant response. His coordination was poor. He was not perform rapid alternating movements. A tender reflex hammer is used to test reflexes. When something is diminished, it is less than normal. A patient is brought to A&E in coma when her name is spoken. She opens her eyes, but she does not answer questions or obey instructions. What is her GZS score? This is 5. Eye opening to speech 3. Verbal response no 1. Motor response no 1. Complete the table with words for navy and the oppositor and related forms. Curative. Size, excision, growth, growing, invasion, invasive. Abstraction, palliation, palliative. Palpa, palpation, palpable. Spreading. Swelling, swollen. The notes below are about the patient described in the opposite. Use them to put the sentences 1 to 9 in the correct order to make the next paragraph of the case report. Use Appendix 2 on page 20 if you need help with the abbreviations. OET 37.8 Celsius. On examination, his temperature was 37.8 Celsius. Smooth, firm, 4 centimeter mass in our supraclavicular fossa. 3. There was a move 3 times 4 centimeters mass in the rear supraclavicular fossa. Notes 1 to 2 centimeter in diameter, palpable in both axial and inguinal areas. There was enlarged lymph nodes in both axial and inguinal areas. Oropharynx NAD, his mouth and throat were normal. P pulse 100 per minute regular. BP 100, blood pressure 112 66. His pulse rate was 100 per minute, regular blood pressure 112 over 66. CVS, NADRS, NAD. His cardiovascular respiratory systems were normal. At mass palpable 3 centimeter below left costal margin. Abdominal examination, there was a mass palpable 3 centimeters below the left costal margin. CNSNAD, examination of the central nervous system was normal. Complete the sentences, look at A, B, and C opposite to help you. A distant spread of tumor cells is known as metastasis. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. The opposite of painful is painless. A malignant neoplasm is called a cancer. Tumors which do not invade or metastasis are benign. Secondary tumors are those which results from the spread of a primary. If a cure is not possible, palliative treatment should be given. A palpable liver suggests metastasis. Complete the sentences, look at A, B, and C opposite to help you. A baby that is born a week before the EDDD is premature. Termination of pregnancy may be necessary for medical reasons. The first 3 months of pregnancy are known as the first trimester. Fetal distress in the first stage of labor is an indication of cesarean section. It was a breach of presentation in delivery was by forceps. Umbilical is another term for spontaneous abortion. The cord was worn tightly around the baby's neck and it was unfortunately stillborn. Complete the table we worked for an opposite upward abortion, a delivery, induced induction, miscarriage, presentation, termination. The minute at SHO is presenting a patient at a weekly meeting in the obstetric unit of a hospital. Complete the presentation with the correct forms of verbs from 29.2 above. This is Clara Davis. She came to the antenatal clinic at 9 weeks. In her past obstetric history, she had pregnancy. She was 18. We was terminated, and another one a year later, which spontaneously aborted. Since then, she has had 3 pregnancies. In the first, the baby was delivered normally at 40 weeks. In the second, she had an induction at labor at 39 weeks because of fetal distress. The third baby presented as a breech was delivered by cesarean section.